All right, thank you so much, Mr. Kauju, for agreeing to this interview. How are you doing? How are you doing in these times, you yourself?
These are really hard times, not just for me, but also at the city of Kampala. But we are managing, and we are hopeful things will get better.
I want to know about you. How are you doing?
I'm doing fairly well. I could be better after COVID, but yes, we will manage.
Okay, we'll manage. How is KCCA handling? I'm sure there's quite a bit of work on your hands right now. What are your priorities? What are you doing? How are you managing?
Yes, our priority now is to work with everybody on the task force in Kampala to ensure that we do as much as possible to prevent and control the spread of COVID in the city. Kampala is a very, very congested area. We have about 5 million people during day and about 2 million people in the night. And what we have done in the past, I'm sure the public has seen, we have experienced and implemented a number of closures, especially of places that used to have so many people, schools, bars and nightclubs, cinema halls, and all, places that host so many people. And what we still look at as a challenge right now is the markets, because definitely much as we have these lockdowns, people still need to eat. And so we still have markets in the city. And I should say it's one of our points of serious attention right now. And we're trying to do our best to work with the market leaders, to work with the vendors working in these markets, especially in as far as ensuring that they are keeping a safe distance.
Okay, so we know some markets were closed down, yeah, and I think I'm just trying to understand, in closing them, was thought given then to the people who need to utilize these markets, considering they can't now drive and go far away or take a taxi? Were options given to them, and what is the fate of these markets?
Yeah, we first of all want our people in the city to appreciate that we actually not going through normal times. This is a time where everybody has to fight very hard. First of all, to start with themselves, to ensure that they are safe. And then after that, we go to care for the spaces that we work in. As we speak now, a number of businesses have been suspended. People are not working. As you know, taxis are not on the road, buses are not on the road, borders are not on the road unless you're delivering cargo. The bars are not working, the saloons are not working. So it means there are quite a number of people that are closed out there. But because our attention now is on the health of the people, is on the livelihood, on ensuring that people are safe. And then the economic bit of it, of people making money and all that, will set in. So we want our people to appreciate that even when we are coming to you in the markets and telling you that you need to improve, and when you fail to improve, we come and close, it means we are actually minding about the life first. So before we closed and suspended some of the operations of the markets in Kalere, because the entire Kalere was closed, we closed the section of Nakawa Market, and we have also sent out notices to people in Busega, to people in the main Nakawa market in Kasubi. We know that a number of people derive a livelihood in these markets, but also should anything go wrong and we have cases in these markets, we'll have a very rapid spread of the virus. So we are working with them to ensure that they can improve, they can observe the guidelines in terms of the distancing, but also the hygiene and sanitation generally in these markets. We're telling them that markets should have an entry point, a clear known entry point, so that we don't have a porous, porous entry and exit. We should be able to control people. They should be able to wash their hands. We should know who is coming in and after who. So that will help us, so that at the end of the day, when we are back to normal, people can go back to do their normal business. Otherwise, as of now, we are appealing to members of the public, especially the market vendors, and also we people who go to the market to buy, that we should be very, very key in ensuring that we actually moving by the regulations and guidelines that has been given.
So if I hear you right, what you're saying is that if these markets,
all markets,
if they adhere, there is a chance that they could be reopened.
Certainly, yes, because we know that our people have to earn a living. And so we are working with the vendors. For instance, all through the weekend up to today, we've been working with the vendors and their leaders in Kalere Market to ensure that they improve. Right now, they're actually demarcating and marking areas where they should be working, like where one person should be and the other. So we are working with them so that there is improvement. Once they have improved and we see that it's not a health risk, then we are going to reopen. We are working on guidelines together with them to ensure that they can reopen.
All right, Mr. Kauji, talk to me about the women who clean the streets. These are from KCCA, I know. What is it like for them? How are you enabling their work and helping them to keep safe during this time?
The women and men that clean Kampala are our heroes. They actually make our jobs. They make this Kampala shine. They make the city look good. And we are not taking their lives for granted. We are working with them to provide gear, first of all, but also to tell them to be aware of the challenge that we have now, the health challenge that we have now, to ensure that they actually come to work when it is when there is light. They shouldn't come in the night because a number of them used to come in the wee hours and it would be a problem. So we want to ensure their safety. And then when they are working, they should also have gear. And we have told their supervisors that we should not allow anybody that does not have gloves, that does not have the masks, that does not have gumboots. So we are working to ensure that they are safe. And we have also, just like we have spoken to all our staff, we've guided them on what to do in terms of keeping distance and also observing. Should they be working anywhere closer to anybody who has all these symptoms, they also need to quickly engage their supervisors so that they are taken care of. So we've done our best to ensure that they are provided for and that they are aware about the health challenge that we have, and that should there be a problem, they will be taken care of.
And so they have medical insurance, or you will cater for their medical insurance in the event that something does happen?
As you are aware, right now, government is actually treating anybody who has been affected by this virus. So in the event that any of us fall sick, they will definitely get treatment by government.
All right. Another thing that keeps coming up is the other illnesses away from COVID-19 and how people in different situations are able to access health facilities. And I know that the government has been working to ensure that there's transportation for them. How is KCCA playing into this?
We have been working for the second week running to ensure that we provide people with other health emergencies with transport, following the closure of public transport and then private transport. So government decided that we should be able to pool vehicles or to bring all vehicles into one pool. And then we have set up a call center which works 24 hours a day. And the number for people to call is 0800 99 0000. So we have encouraged members of the public, and we have posted
do you want to say that
everywhere.
number again?
Yes, the call center number for people to utilize when they need a transport for any other health emergencies other than COVID is 0800 99 0000. So what is happening is that we have a pool of vehicles, including ambulances and other government vehicles. When somebody calls, say for instance, there's a lady who wants to go into labor, there's an accident, there's somebody who has to go and pick their medicine, we are able to dispatch a transport at the earliest time possible to go and pick these patients and then to the hospital and then back to their home. And it's done an amazing job. We've been getting a lot of feedback from the public appreciating what is happening. So we get overwhelmed because people call even beyond Kampala. Right now, we're actually not serving Kampala alone. We are serving the greater Kampala metropolitan area, including Kono, Watiso, Mpigi. And so we are working 24 hours to ensure that we provide this service. So people, should you have any health emergency, whether it's COVID or not COVID, please reach us on those numbers. We'll be able to come to you and ensure that you're delivered to any health center to give you service.
So are there any vehicles that are stationed in particular places that people can then access? Because I know we were speaking about medical workers being able to also utilize this for transportation.
Yes, we have stationed vehicles in over 21 locations of the Greater Kampala metropolitan area. So depending on where the call has come from, we'll be able to quickly link that person or the caller online to the driver nearest to that area, to the location where that person is. And so this is working out. Like I said, it comes with a lot of pressure, but we are doing our best to utilize the resources that we have to ensure that we get to the people and deliver them to the health centers where they should be getting service at the earliest time possible.
All right. Are we looking into getting a shorter toll-free number besides the 0800 that we need to, really think about it? Are we thinking about something shorter, quicker, and simpler for people to remember and dial the,
Yeah, for now, that is the one we are having. We are into discussions to find out if we can use a shorter code. But unfortunately, right now, that's the one we are using. And it is very easy to cram. Once you get the first 0, then the 800, the 99, then the quadruple 0. It should be easier for people, especially if you have an emergency. So we pray that you can actually bear with us for now and utilize that number. We'll be able to attend to you.
You've said it so many times, it's easy for you. Well, thank you so much, Mr. Kauju, for taking the time to speak with us. We really appreciate that. We've run out of time, but I salute you and I salute all of your team that is working together, especially those women that are getting up very early to ensure our streets are clean and that we're, managing hygiene on top of everything we're dealing with.
Thank you very much, Josephine. We keep reminding people to wash their hands with soap, keep a distance, don't go out to crowded places, and together, working very hard, we will emerge victors. We'll overcome. May God bless you.
Me too.